Hi, my name is Ada Marie, and I'm a family nurse practitioner student, and I will be assessing Christine. And Christine, do you give me permission to complete an assessment on you for the thorax and the lung examination?
I do.
Okay, excellent. So I will be posting this video onto YouTube, and we will be observed by my professors and some of the students. Okay, so to begin, we're going to start with inspection. What I'm going to first do is I'm going to assess the chest for any abnormalities. And in this case right now, I'm looking at the anterior. I'm looking to see if there's any barrel chest. I'm looking at the posterior to see if there's any kyphosis or any type of curvature. I do see that it's pretty symmetrical. I don't see any abnormalities as far as any curve. I do see that the I'm looking now just to make sure that the respiratory efforts and the movements are okay, and they seem to be normal. I don't see any retractions or any difficulty. Do you have any difficulty breathing?
No.
Okay, excellent. Do you have any asthma? Okay, and I don't see any accessory muscles showing that it's hard for you to breathe, so you seem to be normal at this point of inspection. So I want to just look at your nail beds if I can, and each nail bed we're looking to make sure there's no cyanosis, any bluish color to the nails. I don't see any of that. They seem to be pink and warm to the touch, and capillary refill seems to be good. 1, 2, 1, 2. 1, 2, 1, 2. Very good. Each one is normal at this time. So skin seems to be great. As far as any clubbing, I don't see that, and the overall color seems to be good. Okay, so now the next thing that we're going to do is we're going to palpate. Okay, so what I'm doing in palpating is I'm going to just make sure there's symmetry. So I'm taking both hands. Symmetry, symmetrical. Okay, good.
I'll turn.
Okay, it's symmetrical. You don't see any abnormalities of the back at this time, especially when I palpate. I'm not feeling any type of masses or any abnormalities. Okay, very good. And so the next thing we're going to do is we're going to do the tactile firmitus. So I'm going to check posteriorly, and then I'll check anteriorly. So I just need you to say 99 for me.
99, 99, 99, 99.
Okay, and then if you can turn around for me.
99, 99, 99, 99.
Okay, very good. Okay, so it seems to be normal. It doesn't seem like there's firmitis at this time when we check that. Okay, so now the next thing we're going to do is check the costochondral tenderness, if there is any in the back. Can you tell me if you have any tenderness?
Oh, 1 second.
Do you have any tenderness?
I don't. No tenderness.
Okay. No costochondral tenderness. Good. Okay, you can turn around. Okay, excellent. All right, and so now I just need you to, I'm going to compare the size by percussing each side just to make sure that everything is okay. So I just take my fingers and I'm going to percuss. Good. In the back, you can turn around for me. Okay. Very good. Okay, excellent. Very good. If you can turn around for me, please. Okay, so now the next thing I'm going to do is I'm going to check the diaphragmatic excursion. Just, bilaterally, I want to make sure that everything is okay as far as the diaphragm. Okay, very good. Okay, so the percussion portion is finished. Now what we're going to do is we're going to auscultate in a ladder fashion because I just want to make sure, compare one lung to the next. Take a deep breath for me. Okay, sounds nice and clear. I don't hear any wheezing. I don't hear any rhonchi. I don't hear any crepitus or any abnormalities. Again, take a deep breath. No wheezing, which would mean that you may have asthma. I don't hear any of that. I don't hear any rhonchi either. In the back, in the ladder fashion, we're going to start here. Okay, take a deep breath. Okay, no wheezing, no rhonchi. No wheezing, no rhonchi. No abnormalities. They sound clear. Okay. And one side's clear. I'm going to check the sides now. Lungs and compare it to the other side. Okay, excellent. They sound good compared from one side to the next side. Okay, and so now the next thing what we're going to do is, because we check the anterior, we check the posterior, we check the lateral on the side, and we also make sure that we check the apices. Okay, so now at this point, you have completed the lung examination. Thank you.
Thank you.
I think we did it right. It seems like it was just a little bit.
It's not moving, so it's still on 7:30.